Welcome to FSCDR TV, Warriors Within. We are doing this podcast to bridge the gap between sickle cell warriors and making awareness between them and our general population. So with this podcast, I have a special guest named Tannikqua. How are you, Mama?
I'm fine. I'm doing good.
I'm happy that you decided to join me.
Yes, I'm happy to be here.
I'm loving your personality because you are so bubbly, and it was just a pleasure just like getting to know you for a split second. So I want you to tell me a little bit about yourself, as in, let's start with this. So you're originally from Florida.
Yes, well, I'm Jamaican.
Okay.
Yes, but
And
I've lived in Florida. Yes.
so that's great. I like to know that because I always ask this. With having sickle cell, usually in Jamaican culture, is self-medic, like, herbalists, all herbal medication.
Yeah.
How did your parents, like, educate you and help you, like, medicate yourself and teach you? Because I always say to everybody I interview, it's harder for people in third world countries to have access to the things that we have here.
Yes.
So how did they help you? Let's start with that.
So, well, for me, when I was diagnosed with sickle cell at birth. My parents were unaware that they had sickle cell, so they learned that they had sickle cell from me. Like, my dad has SC and my mom was a carrier. She has the trait. So they learned that they had sickle cell once they gave birth to me, and the hospital did blood work and was like, hey, something's kind of wrong. They tested my parents. But I never really had to be, like, growing up, the only issue I had, like, as a young child, was my spleen used to get swollen sometimes. Okay. But I used to get medication for my spleen, but at that time my mom was medicating me. And then after that, I never got sick again with my sickle cell until 16. So at that time, I was old enough to kind of understand. And I was, living in Florida, I was able to understand how to medicate myself. So I never really had to, like, get medicated as, like, a young child.
But that's pretty good. So you grew up your whole, like, childhood, not in crises, until 16.
Yes.
So what happened when you turned 16 and you got into your first crisis?
So when I was 16, like a month before that, I went to the hospital to get a blood transfusion just because, like, I was a little anemic and I felt really weak. Got a blood transfusion, went home. Then, like, 2 weeks later, I woke up, like, I was taking a nap and I woke up and, like, my body was just hurting, like, very bad. So I went to go tell my mom, like, something doesn't feel right. Like, I'm in tears. I'm like, something does not feel right. So she was kind of shocked because, like, we knew I had sickle cell, but we didn't know the depths of sickle cell. Like, we didn't know how far it went. Like, we didn't know a lot. Like, we just knew, like, certain things like climate change and stuff like that, but we didn't understand, like, how deep sickle cell really is. So at that time, my mom wasn't aware that I was having a sickle cell crisis. She was just kind of in shock of, like, how would I just wake up and be in pain?
Yeah, because it didn't make sense to her.
Exactly. So when I went to the hospital at that time, they were treating me, and my mom told them I had sickle cell and stuff like that. They asked for your medical history. And when they did my blood work and stuff, they're like, wait, she's having a sickle cell crisis. So then that's how my mom was like, wait, okay. So we were then at that point, we were aware that I was having a crisis. And then I got to really experience, like, what a crisis feels like. So I was able to figure it out ever since that point. Like, I would know what a crisis would be, and I would know, like, what the pain is. So if I had any pain beyond that point, I was able to say, okay, Mom, something's not right. I need to go to the hospital. But it was at that time I was in pediatrics, so it was a scary experience. But with pediatrics, they make you feel comfortable. Yep. So it's like I wasn't, like, I was afraid, and I was like, the experience was scary, but my mom was by my side the entire way. And I just, like, in pediatrics, they care for you. They really want you out of pain.
They do. And
they did everything in their power to keep me out of pain, and they had people come in my room to sing to me. They had dogs. They had iPads. They did anything to just keep you comfortable and, as a child, keep you happy. So it wasn't a bad experience besides the pain. But as the care part, I was cared for, and I felt like they really wanted they had my best interests at heart.
So when you went into your first crisis at 16, what were you thinking? Like, mentally and everything. Like, what were you thinking about, as in, like, I basically went my whole, like, childhood, almost teenage years, and now I'm 16 and I'm here in the hospital, and this is exactly, like, now this is it. Like, I know this is what it's like to have a crisis. What was going through your mind?
I was terrified. I was scared because at first I didn't really like understand. Like, I'm like, wait, sickle cell crisis? Like, this what it feels like?
Yeah.
Like, I was not expecting that. I was expecting, like, you know, because sometimes, like, my joints would swell up and I get a little Tylenol and I go to sleep. Yep. I was expecting, like, that's it for sickle cell.
Yeah.
Like, joint swelling, Tylenol, go to sleep. My mom rub it with some icy hot. I take a nap. I wake up and I'm fine. So when I'm in a hospital bed and doctors are coming in and all this stuff, I was terrified. But one, I had my mom beside me. So that gave me peace and to know that, okay, my mom's here, so nothing can happen to me. My mom's with me.
Yeah.
So I felt safe because my mom was there. I was terrified, but I honestly was doing research. Like, majority of the time I was in the hospital, I was asking questions like, what are you giving me? Why are you giving it to me? What does it do? I'm one of those people where I want to know everything. I want to be involved in my health because it's my health and it's my life, and I need to know what you're doing and why you're doing it. So at that point, I kind of dove into sickle cell because I'm like, okay, this is my life now. I need to understand what's going on, why it's happening, how can I stop it? Is there anything that I can do? So I just used to be in the hospital bed doing research on my phone.
That's good.
I used to be looking up everything, watching YouTube videos, reading articles, and trying to just better understand sickle cell because it's like, okay, this is the start of it. Like, this is what it's going to be, so I need to know what's going on.
So when you started doing your own research, it didn't make you more scared? Because I'm going to be for real with you. My son is sickle cell anemic. And when I found out, like I tell everybody on the show, I have knowledge of it, but when I would research stuff, I feel like on internet it made you more scared. So when I was sitting in the hospital, I was like, oh my God, like I shouldn't read that. Like I was like, close it. Like, let me not. I'm just gonna ask the doctor questions.
Okay.
So it didn't scare you because I'm only imagining, like, I'm 16. Now I'm in my first crisis. Now I'm looking up everything. And I'm like, oh, my goodness, my body is going to start doing this craziness. Yeah. I can go through this.
I don't know. I think I'm a little weird because, okay, so, like, I'm the type of person, like, I feel like I get comfort in knowing what's wrong. So even, like, when I was getting my port put in or when I was getting my gallbladder removed, I get anxiety when I don't understand what's going on. And I get comfort in knowing what's going on. So, like, surgeries and stuff like that, I get anxiety because I'm asleep. I don't know what you're doing.
Yeah.
So, in order for me to feel comfortable, I go on YouTube and I watch them do the surgery so that I know what they're doing to me. So, when I read the articles on Google, it doesn't make me scared. It gives me comfort because I'm like, okay, so this can happen and that can happen. So, it's like peace to me. Like, if I don't know what's going to happen, that's what makes me scared. So I might be a little weird, or I don't know. It's just the way that, it makes me more comfortable. Yeah, it just makes me more comfortable to know what's happening, what can happen. And so that's just how I am. I just, like, look up stuff, and I just feel at peace, and I feel relaxed and at ease. Like, okay, so this is what it is.
So going forward, after your first crisis, what did you want, like, learning from that? Like, what did you take from it? Like, okay, from now on, now I feel like I need to educate. What did you find as a helpful resource? Like, wow, I didn't know this. Now, I have sickle cell, and I need to take this valuable information and run with it.
Well, I always had my cousin because my older cousin has sickle cell.
Okay.
So that was always one of my biggest resources. Like, because I didn't really have friends with sickle cell. I have my cousin. So I would just text my cousin, like, this is happening, like, is this normal? What should I do? And she'll be like, oh, no, that's normal. Like, take your medicine, go lay down, or do this or do that. So that was, like, my biggest resource was my cousin, because that was the only person that I knew can 100% relate and understand me. Yeah. Like, that's one person I know that if I go to you and I show you my ankle and I say my ankle's swollen, you could tell me, okay, that's normal, elevate your ankle, or no, that don't look too good, tell your mom to take you to the hospital, or take your meds, or put this on it, or use this, or I tried this, or I did that. So that was my biggest resource, because at this time, I didn't have friends that had sickle cell. I didn't have, like, a clinic or a support group or anything like that. I just really had my cousin and Google. Yeah. And that was what helped me to get, like, through, like, if I was ever afraid or I wasn't aware of something, I would go to my cousin and I would go to Google.
So after being 16 and being having your first crisis, did you have more after that?
Yeah. So then after 16, that's when my sickle cells started sickle selling. Like, that's when it's serious. Like, yeah, that's when it was, because it usually happens like that. That was my turning point. That's when it's like, okay, so yeah, all right, now we're going to act up. So I would get sick probably like every 2 months or so as a kid. I've had points like when I was in pediatrics, I would get sick probably like every 2 months or so. Then, like I said, it's pediatrics, so you get great care. Like I had no issues in pediatrics. Then I transitioned over to adult care at like 18, and I would still get sick like every 2-3 months, or probably like every other month or every month. It depends. Like there's times where I don't get sick for 6 months, and there's times where I get sick every month. It really just depends on what your body feels like doing.
Yeah,
Like
because your body do let you know. I noticed that with every sickle cell person, they can tell you when they about to go down.
Yeah, you can tell. There's signs, and there's sometimes it happens like this, but sometimes you can really like
you can feel it.
Feel it, like okay, you can look at your eyes or stuff like that, and you can tell.
So after being 16, then after you said like that's when it start kicking in. What did you realize? Like, what was your mindset at that point? Because I always ask every warrior this: mentally, y'all are the strongest people ever. No, y'all are strong as ever.
It's true.
And I always ask about how was your mental at that point? Because 16, my first crisis, I'm okay, and then after this, now I'm in the hospital. Yeah, like I'm sick that's a lot. That's a lot.
Especially being young. I don't know, but I've always like, even being 16, I've always had like a positive mindset, and like I always grew up where my mom always told me to pray, like pray, 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 and I would have my sister praying for me. I would have my mom praying for me. So it's like even being 16, I was never really afraid.
Yeah.
Like I never really had a point where I was like, I'm scared.
Yeah.
I never really got afraid. I just understood that this is my life and I'm different, and I was okay with that. I had comfort in that. Like I wasn't mad, I wasn't angry, I wasn't scared. I just understood that like, hey, you're different than others. There's certain things you can't do. There's certain things like I just wanted to just my whole thing was just understanding what I can and can't do and trying my best to like get better. Like I understood now that I had to drink a lot of water, so I would try to drink a lot of water to hydrate myself. Those were the things. But to like say I was afraid or I was scared or anything, no, I just knew that I'm different and this is my life. Like I can't escape it. I can't do anything. I can't run away. I can't like leave it. It's gonna be here. So let's get comfortable. Let's sit down and let's get comfortable, because that's really what it is. I just got comfortable with my sickle cell. I understood that hey, we besties. We're going through this together. Like I can't do nothing about it.
So I always say to my son, because sometimes when they go, like when he gets in his crisis, I'm like, always remember, sickle cell doesn't have you. You have sickle cell. So I say that to say it goes along with the support with that. Because when you're fighting, your support fights with you. So the prayers, every sickle cell warrior I've came across, they always want abundant of prayers and support. What is your support like? You have I can hear it so much in the background that you kind of have a good support. But what do you think about other people's? Like we talked a while ago, and you said that your friend that you didn't know that you went to school with had sickle cell. Your support compared to other support. Have you ever looked at that on the outside?
No, I have a very, thankfully, thank God, I have a good support system. I have my mom that's always praying. I have my sister. I'm in the hospital. I press call. My sister, okay, I'm hanging up. I'm going to call them. Like, I have my boyfriend if I'm in the hospital, and I say, like, listen, they're not, I'm coming up there. Like, I have someone that I could pick up the phone and say something's not right. I have someone I have everyone around me, thankfully, that supports me. They understand. They don't judge me. They literally are there to fight with me.
Yeah.
And if I can't fight, they're going to fight. And if I can't talk, they're going to talk. So I have a very, very good support system. I have my cousin, Kristen, that has sickle cell, that I can always call and text, and we go through it together. And I tell her, like, hey, this is wrong, that's wrong. She helps me. Now I have like friends with sickle cell because of the foundation. I have people that also have sickle cell. So now I have like friends and people that, and acquaintances that I could reach out to and stuff like that, and they reach out to me. Thankfully for the foundation, I was able to get like more of like support from other sicklers around my age group or even older than me, that sometimes we text each other, call each other, we check in and say, hey, how are you? You okay? I haven't seen you in a while. You doing okay? So now I have that. But before, I didn't really have friends. I did end up having a friend in school where we graduated, and we were on the phone one day, and I think we were talking about, like, she was saying something about going to the pool, but it was cold outside. And I was like, oh, no, girl. If I would have went to the pool and I would have got out, I said I would have been in pain. And she was like, why would you be in pain? And I'm like, because I have sickle cell. Because at that point, I was comfortable with it. I was like, no, I'm not going to hide my sickle cell no more. This is me. So I was like, I have sickle cell. She was like, oh, my gosh, I have sickle cell too. And I'm like, we went to school together for so long. We're close friends, and we both never discussed that we had sickle cell. And then ever since that point, like, we would always, like, check in on each other because we understood. And I was able to have her until I ended up going to the foundation and meeting more people that also have sickle cell. But it's important, especially, like, for your son and stuff, it's important to have support. Yeah. And people around you that you can reach out to, because, like, our parents, like, you guys will understand. But you guys don't really understand because you guys can't physically feel it. So it's like, it's a certain level of understanding that you guys can have. You sometimes need someone that can feel it, like they really experience it, so that their understanding is a lot different than just, like, you know, our parents or someone that doesn't go through it with us.
No, agreed. I do agree. I always say that because I can relate to you, but I can't really relate. Yeah. I can only relate on a mother aspect. And as a mother aspect, like, that's why I say I'm a big advocate for anybody sickle cell trait or warrior. I'm a big advocate because of what I see my own go through. So what I see my own go through, of course, I never, ever, I don't care if you 70 years old as a sickle cell warrior. Knowing me, my little self probably going to talk up the loudest to make sure that's never going to happen. But I want to ask, like, so when you transition, because we always ask the story about transition from pediatrics to adult. Was that different for you?
Yeah, it was. It was scary because I was like, oh, my gosh, I'm going to the hospital. I'm about to be around all these older people. I don't want to be around them. I thought, like, the nurses would be mean because I'm like, oh, my gosh, they're going to be mean to me. But they weren't mean. There's good nurses on the adult side. But it was scary because I went from, like, just going to the hospital, saying I'm in a sickle cell crisis. They ask me my pain. I tell them my pain score. And then I just get treated. Like, I just lay back, I get treated.
Pediatrics, right?
Yeah.
Okay.
But then when I got to adult care, it was like, I go into the hospital, I say I'm in pain, and you're like, are you really in pain? Oh, why aren't you crying? Why aren't you screaming? Why aren't you punching? How are you so calm? You can't be in pain. There's no way you're in pain. You look better, you look fine, you're on your phone, you're talking, you can't be. So it was like, it was a big switch. I'm like, wait, what do you mean I can't be in pain? Like, I'm used to just coming into the hospital, even if I'm crying or not crying, I tell them I'm in pain. I get treated for my pain. Yeah. But now I'm here, it's like, you want me to come in here crying every time I tell you I'm in pain. And they don't understand that, like, with sickle cell, our pain tolerance is different. Yeah. So what would make someone else cry? If I tell you I'm an 8 and someone else might be crying for an 8, I might be saying I'm an 8 and I'll just be sitting there like this. It's true. Like, am I going to cry all the time? Like, I can't, like, I don't have that much tears. So it's true. Like, I'm just like, I'm so used to it that I'm just like, all right, I'm an 8. Let's just get this over with.
And I feel like that's like it's like a mask or like a Band-Aid that, like, I'm going to say that you guys wear because you go through it so much. It's like, why do I have to keep repeating myself about I feel really horrible right now. I can barely breathe. These organs are not functioning the way I need it to function. So I do agree. The pain tolerance that y'all experience is beyond anything a normal person can experience. Exactly. And this is where I say the strength and the resilience that any warrior I ever met, it's top tier. It can't be matched because no logical person can really go. Like, I know I couldn't. I wouldn't even put my body through that. So that's why I'm like, that has to be something. So when you transferred over to the adult side into sickle cell, did you have any uncomfortable experiences with any doctors? Well, let me rephrase that question. I'm gonna rephrase it. Did you have any unsettling moments where you felt like a doctor did not understand you in the condition when you was in a crisis?
Yeah, I actually had that a few times. Like, I had it once where it was like, it was life threatening at this moment. I was, when I transferred over, and I was in a lot of pain, like a lot of discomfort in my chest area. And I kept telling the doctor, like, my chest hurts, my chest hurts, my chest hurts. And they kind of was like brushing it off, like, oh, okay, like, you're just complaining, like, you just want more pain meds. Like, you're just complaining, like, we gave you as much pain meds as we can give you. There's nothing wrong with you. You're fine. When you first came in the emergency room, we did a chest x-ray. It was normal. You're fine. So I'm like, no, do another one. Something is wrong. Like, my chest hurts. Like, I've never felt this before. Do another one. And then the doctor kind of just, like, was dismissing it. And then luckily, thank God, I got a new doctor. Like, it was after they switch over and you get a new admitting doctor, I got a new admitting doctor. So when he came in, I told him, like, sir, something is wrong. My chest hurts. I don't feel right. Like, I feel extremely weak. Like, something is wrong with my body, and I can tell, like, it's not good. And he was like, what do you want me to do? He's like, I'll increase your medicine, and I'll also he's like, what do you feel like we should do? And I'm like, I feel like something's wrong with my chest. I feel like you guys should do another scan. And he's like, you know your body. Whatever you want me to do, I'll do it. And I said, okay, thank you. He went out the room. He immediately ordered the chest scan. He increased my meds. He did everything that he said he would do. When they did that, the scan came back. It said, like, I had acute chest, and my heart was enlarged because it was trying so hard to beat for so long and working so hard to keep pumping through my body and blood flowing through my body, and my heart is working overtime that my heart became enlarged. And when he came back like a few hours later, and I knew something was wrong because I'm like, you don't see me twice in one day, so something's wrong if you're coming back. So when he came back, he was like, you know your stuff. He's like, you know your body. He's like, you know what? And it was like around the holiday time. He said, it's a good thing that we did this scan because you probably wouldn't live to see Christmas. He was like, your mom probably would have lost you. And then I was like, I got chills because I'm like, I knew something was wrong. And I'm like, that's how I know God is real, because he got the other doctor off my case just in time to make sure that I was okay. And the new doctor was able to get me ready for like a blood exchange and all that stuff, and get like antibiotics and stuff like that so that they can help with the acute chest and stuff. And I was just so thankful for the new doctor because he came in the room and he listened to me and I felt heard. And the other doctor, she was just more so like just making it seem like I'm just complaining and crying every day and in here crying weak just for pain meds. And I'm like, ma'am, no, something's wrong. And she's like, oh, but when you got admitted, we did this scan, and like, you're going off a scan that you did 4 days ago. Like, do another one. It's not hurting anyone. You're not paying for it. I'm paying for it. So if I want another scan, just do another scan.
Just do it. Agreed.
But I was so happy for that doctor. Like, I always like think about him. I'm like, yeah, that doctor, like, it was scary.
So do you feel like that there is like let's put it like this. Do you feel like there's a stigma after going through your first crisis from being 16 and you're in pediatrics and everything's cool? Because I agree with you, in pediatrics, everything is great. They treat you good. And then, like you said, you cross over to the adult side, it's a little different. So do you feel like it's like a stigma? Like they look at you in a certain way because you got to see the transition from your first time being 16 and now you adult? Because that one, you didn't have that long.
Yeah,
you didn't have that long at all. You only had 2 years.
Yeah, I know. I was like, oh my gosh.
Yeah, you didn't have that long to get no type of adjustment to nothing. So, do you feel like it was a stigma? Do you feel like it was like something like an eye opener? Like it made you see like, whoa, like
yeah,
this
I see that. Like I understand like when they say like we're judged, and they just look at us as drug seekers. They look at us like someone that's just coming in to the hospital saying they're in pain just to get the Dilaudid, the morphine, this, and that's why you're here. Like they just look at you like that's why you're here. And it's very few doctors that really understand sickle cell and understand like, okay, even if they're not crying, even if they're not doing this, pain is what they say it is.
Yeah.
And it's crazy how they're taught that in school, but they don't follow that in the hospitals or at all.
Touché.
That like pain is what we say it is. So if I tell you it's a 10, it doesn't matter if I'm laughing or smiling. I said it's a 10. So you're supposed to treat me for what I say. Exactly. But they don't do that. And I immediately saw that like we're judged, and it's due to the color of our skin, unfortunately, and it's due to our illness. And with sickle cell, we don't have, like, there's nothing else to help us. Like, it's just pain medicine, fluids, oxygen. That's it. And if you need antibiotics, antibiotics. We don't have anything else. So it's like, this is our sense of, like, helping or aiding the situation. So it's like, why not give it to us? We don't have any other choice.
Yeah, for
it's
sure.
Literal pain. Like, there's nothing else that we can do. But they don't look at it like that. They just look at it like, oh, no, you're just here for drugs. But I immediately learned that. And it was pretty sad to understand, like, okay, so this is how we're going to be treated. But I just learned that, like, hey, there's nothing we can do about it.
There's nothing. So what made you, from that point on when you realized that, did it kind of make you a little angry? Did it make you want to, like, be different, like, move differently in the hospital, like, ask differently for certain medications and stuff like that?
Yeah, I learned how to talk to them. I learned how to word things. Because wording is a big thing.
It's a big thing.
In the hospital.
It's a
and
big
I tell
thing.
people that, I tell, like, other patients that, like,
yes,
the way you word something, it
changed the whole
like,
dynamic.
if a doctor's come in and they're like, okay, how are you? You're like, okay, I'm in pain. Like, I learned to stop saying generalized. Because generalized, when you tell them pain's all over, that just seems like you're just saying anything. Like, oh, the pain's everywhere.
Yeah.
Even though the pain can be everywhere, but I learned to focus on where the pain is the most.
Yeah.
So even if I have my legs and my back is hurting too, I'm not going to tell you it's everywhere. I'm going to tell you my back and my ankle's hurting, my back and my knee is hurting, my this is hurting, so that you can know that this isn't just the pain's everywhere type of thing and I just need this and that and that. No, I'm going to tell you exactly where the pain is, and you have to word it. Like, you can't say, I normally get 2 milligrams of this, 5 milligrams of that. You can't do that. You just tell them the medication and let them do their job.
Yep.
Let them do their thing. Because, like, a lot of times people are like, I get 2 milligrams of Dilaudid, 50 Benadryl, Zofran, and this and that. And it's like, it's too specific for me. Like, doctors look at it like, that's too specific. Like, you telling me what to give you? And they'll come in there and give you nothing.
What they suggest.
They'll come in there and give you a Tylenol and be like, okay, here you go, feel better. So it's like, I learned to be like, okay, I normally get Dilaudid and I normally get Benadryl, and I wait for them to ask me. When they say, if they ask and say, what do you normally get? I say, okay, I normally get Dilaudid and Benadryl. I can't get morphine. I'm allergic to it. And then that's it. I let them go out there. They assess and they look at my records. They see what I normally get during my ER visits. They see, okay, this is what she normally gets. They see the milligram. Majority of the time, doctors follow the orders other doctors get, if it's a reasonable order. So if they see that in the ER you normally get this dosage, they're going to give you that dosage. So you don't really have to tell them the dosage, and I let them give me the dosage they give me first. Now, if they give me a dosage and I feel like it's not working, then I voice and say, okay, this isn't working. But I let them try first and do their thing and not just come off as demanding. Because to them, that's a big red flag. You're too demanding, you want too much, you know too much.
And you're sick.
Yeah. So it's like, I let them do their thing. I let them give me what they feel like they should give me. And then I say, like, okay, what you just gave me don't work and it's not helping. And majority of the times they will change it. If that doesn't work, I call my reinforcement. I call my sister, like, listen, they're not listening. And then majority of the time they'll end up, like, changing it and stuff like that. But you have to know how to talk to them.
Agreed. You definitely do. So I want to, like, when we were talking, you said that when I asked you, I said, what advocacy and what awareness would you like to make about sickle cell? And one thing that touched me was when you said that we're human and we're not in a box. Elaborate on that for me.
I feel like with sickle cell, they put us in a box. Like, a lot of hospitals, like, when they do, like, their care plan for sickle cell patients, they just say, sickle cell patients, this is the care plan. And then they want to treat every sickle cell patient that comes through the door with this exact care plan. But that doesn't work because what works for one person may not work for another. But they just generalize us and put us in a box. And that, I don't like that because everyone is different.
Agreed.
What works for this patient may not work for the next patient and so on. So I just want, like, hospitals and medical staff or anyone to just understand that, do what works for that person. Talk to that person. Understand that person. look at what works for that specific patient and treat them accordingly.
Yeah.
And then you get another patient, you look at what works for that specific patient and you treat them accordingly. Don't just have a broad, okay, sickle cell patient, treat them like this. No, because that never works. And everyone's pain is different. One patient could like a PCA pump. Another patient could like when the nurses come in and do a push. One patient can prefer morphine. Another patient can prefer this. Yeah. And they don't understand that. They do not understand.
Yeah, because you just kind of threw me when you just said you're allergic to morphine.
Yeah.
And so I'm guessing like it took for you to actually get the dose in order and get the counter reaction from it to understand it. My son's allergic to Benadryl. So every time I'm going into the hospital and they're like, okay, Mom, we got to give him this, and we're going to give him, we're not giving Benadryl. And they're like, what? Benadryl? I agree. And because like you said, morphine don't work for you, but morphine may work for somebody else. And the pain medicine that they give is a really strong pain medicine. So I feel like that's something that has to be understood as well, because not a lot of people's body can handle, you know what I'm saying? Like, I agree with what you're saying. Like, I could probably handle the morphine a lot better since you allergic to it. Exactly. If I had sickle cell, I could probably digest that a lot better. But the oxy probably works a lot better for you, exactly. And you can manage your pain a lot better. So as a sickle cell warrior, what do you feel like we could implement in the community to make more awareness to the doctors, to the nurses that, hey, I'm not in a box. I'm human just like you. I get up out of here too. I go home. I have a family. I have a mom, a dad, a sister, a brother, a boyfriend. You know what I'm saying? Mm-hmm. What do you think as a community we can infiltrate for that?
I feel like they need to have like more sickle cell patients speak. Like they need to have sickle cell patients a part of these meetings. Like, not saying that we're medical professionals, but we know what works. So if you're having a meeting about a sickle cell patient or what to do for sickle cell patients, I feel like you should have at least 2 or 3 patients in there that you can say, okay, so in your experience, when they did this, how did that work for you? Or in your experience, when they did that, how did that help you? Because at least we'll have someone in there that is honestly going through these things and experiencing these things that can speak.
Yeah.
You can't kind of just have people in there just talking and no one actually experienced these things. No one is the one on the receiving end of these plans and things that you're making. So I feel like there should be a way for us to be a part of those meetings, for us to have a voice when they're doing these things and they're making these rules that they make and stuff that they make. Because, like, hospitals have Dilaudid-free emergency rooms and stuff like that. We need to have people to say that, listen, you can't do that. Yeah. There should be a way that even if you're a Dilaudid-free emergency room, you understand that, hey, there's a patient that may come that can't get the medication that you're giving, the pain medicine that you guys normally give. So what would you do in that case? Like, is there a backup plan? Like, what would you do? A lot of times they don't have backup plans. It's just more so like, we don't do this, we don't do that, and that's just what it is.
Yeah.
So they need to have patients and people that are experiencing the health care, the ones that are receiving it, in these meetings, in these rooms, and there should be a way for us to do that, to get in those rooms, to get in those meetings, to get in those places so that we can be the voice of other sicklers.
Like when we have these conferences and stuff like that, I do agree. It needs to be way more sickle cell advocates there to speak up. Like you said, be the voice, of course, be the voice with support of the doctors and the nurses behind them, because granted, they're the ones taking care and administering, but you guys are the reason why, these doctors are still functioning and doing everything.
The receivers. So it's like,
agreed.
We need to be able to say, hey, I don't think that's a good idea. Or, hey, maybe you guys should probably do it like this. And then, they figure it out within reason. With their medical license and stuff like that, they find a safe way to do these things and make sure it's safe and healthy and good for us. But at least we can have an input.
So in the future, do you see any positive change coming forward, sickle cell?
And
if so, what do you see? Yeah, no, I get it, because it's such a I call it it's like a gem that gets brushed over. Like, you know what I'm saying? Like, it's something so beautiful, because if you really look at the people in the population who have sickle cell anemia, all beautiful people, all strong and valuable. But like I said, it's just brushed over. And we have like new trials, clinical trials, new drugs that could be administered to help out. But sometimes, obviously, going through it, you kind of feel like, is it really like you said, if you already done went through from pediatrics to adults, you're probably like, is it really like, come on now, I done been with this all my life now, and I figured out how to deal with this by myself. So it is hope, because like I said, with all these clinical trials and everything, going forward in the future, what do you hope for as far for sickle cell to be, other than making awareness and for the doctors? What do you hope to see? Because the same way, I kind of go back to what you told me before when you said people should speak up. It kind of goes back to what you said before when you were 16, you didn't want to say nothing. So I'm pretty sure a lot feels like that. Like, I don't want to say nothing because you're not going to understand and you're going to look at me funny.
Yeah.
So what can the future look for people who are quiet with the voice, but like you rose up your voice later down the line?
I just hope for okay, if it's not a cure, because a cure, sometimes it's hard to create a cure for
Agreed.
something, to fully say wipe it away. Even though there's things that we have bone marrow transplant and stuff like that, but a lot of times it's hard to get a bone marrow transplant, and they don't explain that the bone marrow transplant, your body can reject it. It may not work. So I just want to see something that helps it be manageable, so people can have normal lives, as normal as possible. Just something to just help us to just live a normal life, help us to be as healthy as possible, even if it's not a cure, it's a medicine that we can take, and for it to be affordable.
Agreed. When you say normal, elaborate on that, because a lot of people going to be like, normal? Well, girl, what you talking about normal? They don't understand that. Like you said, the pool, that's one.
Exactly.
They don't. So when you say normal, you wish that normalize going to the pool, going to the beach when it's still like 60 degrees and you can take it. You could do it. That's what you mean by normal.
Yeah, normal. When I say normal, because I think I live a pretty normal life, even with sickle cell. But normal, when I say normal, well, let's say carefree. Like, where you can just, you look at a ride at the park, or you're at a fair and you look at a ride and you don't have to think twice, like, should I go on that? Mm-hmm. If I go on that, would you just think, be an average person and say, I'm going to get on that ride, I'm going to get on that ride. If someone says, hey, girl, let's go to the pool, okay, it might be a little chilly out. You don't have to think twice, like, if I go to the pool and I get out, am I going to?
Gotta hurry up and bundle up,
exactly.
Stay warm.
You could just be like, okay, I want to go to the pool.
Yep.
If you want to wear a tank top and it's kind of chilly outside, you don't have to think about, okay, I'm going to bring a jacket, I'm going to bring this, I'm going to have to pack my meds, I'm going to have to pack this, I'm going to have to. You just do it. If you're going on a flight, you don't have to worry about how far you're going. You don't have to worry about, okay, I'm going to be on a plane for 6 hours. I need to make sure I have enough meds. You have to plan your trip around your refill time, like stuff like that. Like, we always have to, like, if we're going on a trip, you have to make sure you have your meds. You have to make sure you have this. You have to make sure you have that. Make sure you're getting your script in time for your trip.
Yeah.
A lot of stuff, like, we have to do a lot of stuff to be able to just enjoy our life to the fullest at 10,000%. But if we can have just a carefree life where we could just get up and just say, we want to go on a trip, we're going on a trip. We don't have to worry about refilling no meds. We don't have to worry about, do we have our pain meds? We don't have to worry about, okay, make sure my hotel is near a hospital if anything happens, or you have to think about so much. If you want to go out the country, you don't have to worry about, I have to bring this and bring that. You can just go out the country. You can just go to Dubai. You don't have to think about being on a plane
and
for
have to worry about if you get sick over there.
Yeah, because we have that fear of, like, going out the country. Being on a plane to go to Dubai, you have to think about being in the air for so long, the oxygen and stuff like that. There's a lot to think about with sickle cell. Yeah. We can still do these things, but we just have to have a lot of precautions. We have to make sure that things line up accordingly when we're planning certain things or doing certain things in life, and not just be able to just plan a trip with your friends and you don't have to think about anything.
I always tell my son that the spontaneousness kind of goes out the window. It's more of, like you said, a logic and a pre-plan. So I totally agree. I hope for the future that is something like every sickle cell person can really experience, because it's heartbreaking to know, like, simple things like that you want to enjoy that and you have limitations to enjoying it. And I'm happy you got to express all of it, because hopefully somebody else, like, watching this will actually get a better understanding. Because I agree with you, being quiet about it, it's hard to speak up about something and everybody look at you funny, and then hopefully somebody will watch this and be like, wow, I never thought to speak up because I could change the way. Mm-hmm. But I thank you. I'm going to wrap this up, and I thank you for coming. It was such a pleasure talking to you, and I thank you for just dropping all your gems on me and just expressing, like, the uniqueness that you want to see, the positive change for sickle cell. Mm-hmm. And that completes our episode. Thank you.